All right, so with heat exhaustion, you're going to get severe cramps, dizziness, nausea, profuse sweating, headache. Management, we want to move to a cool environment. We don't want to rapidly cool them down too fast. You could cause shock. Administer replacement fluids and cool the patient with a cool water spray, not ice. Heat stroke, if they are over 104, where their central body temperature, they're going to have confusion, irrational behavior, could become combative, go into a coma, flushed skin, pulmonary edema, dysrhythmias, GI bleed, clotting disorders, reduced renal function, hepatic injuries, and electrolyte abnormalities. Sweating could be absent at this point. They're out of water. Management, move to a cool environment, cool by fanning, keep the skin wet, and administer fluids. If they're having seizures, we're going to give them benzodiazepines such as midazolam or Versed, 5 milligrams. Skip the review. All right. More trauma, nope. Gynecological and pregnancy terms. So we have ovarian cyst. This is the thin-walled, fluid-filled sac on the surface of the ovary. Could result in significant hemorrhage. Abdominal pain may be caused by rapid expansion, torsion, or acute rupture. Vaginal bleeding or late missed period at a time of rupture could also be an issue. Localized one-sided lower abdominal pain, and we're going to treat with IV fluids, pain management, and rapid transport. One of the number one issues with females, if they're having pain down there, could be an ectopic pregnancy. So it could be a pregnancy that develops outside of the uterus and the fallopian tube. So the word ectopic in and of itself means not where it's supposed to be, just like you could have an ectopic heart wave or beat. PVC, PJC, all of those things. So third leading cause of death, maternal death, typically found at 8 to 12 weeks gestation. So you're going to get vaginal bleeding, crampy abdominal pain, spotting, rigid, stiff, board-like abdomen. After the rupture, severe abdominal pain, vaginal spotting, internal hemorrhage, sepsis, and shock could follow. So management, we want to give IV fluids, pain management, and transport rapidly for surgery. Oh yeah, so pregnancy terms, we have dysmenorrhea. This is pain during menstruation. Headache, faintness, dizziness, nausea, diarrhea, backache, leg pain caused by the muscular contraction of the myometrium. Infection, inflammation, presence of an intrauterine device, IUD. Mitt-Schlesselmer's pain, this occurs as the result of a follicular rupture and the bleeding from the ovary during the menstrual cycle. Pain in the left or left lower abdominal quadrant during the normal mid-cycle of menstrual period. To differentiate pain from appendicitis or surgical emergencies. So appendicitis, if we're having an issue there, you're going to put pressure on the lower right quadrant, and there's not going to be pain. But once you take that pressure off, if there's pain, that means that they're having a burst appendix or appendicitis. Gravida. So gravida is the number of times that a woman has been pregnant, including right then and there if she is pregnant. Not necessarily how many kids she's had. Para is the number of live births of infants born after 20 wecs gestation. So think paratroopers, you're dropping into the world, right? Like you're jumping out of an airplane. All right, para is the number of kids that actually touch ground. Antepartum, this is the maternal period before delivery. Intrapartum, this is the maternal period during delivery, and then postpartum is the maternal period after delivery. Antepartum, intrapartum, postpartum. Term is a pregnancy that has reached 40 weeks gestation, and first stage of labor begins when contractions and the ends of the cervix are fully dilated at 10 centimeters. I thought that it was 8 centimeters, but I guess for this book's sake, it is 10 centimeters. Second stage of labor, measured from the full dilation to delivery of the newborn. So the third stage of labor begins with the delivery of the baby and ends with the placental delivery. This was definitely a test question that I missed. So your first stage of labor, that is whenever contraction and cervix is dilated at 10 centimeters. That's when it starts. The ball game has begun. Second stage, this is measured from full dilation to delivery of the newborn. So full dilation and the newborn's out. And then the third stage begins with the delivery of the baby and ends and concludes once the placenta comes out. Precipitous birth, this is onset of labor to birth is less than 3 hours. So if you have a quick birth, like normal. Ovarian cyst, the thin-walled, fluid-filled sac on the surface of the ovary. This could result in significant hemorrhage. No, wait, we already went through all this. All right, pregnancy emergencies. So you could have placenta previa. This is the placental implantation in the lower uterine segment, partially or completely covering the cervical opening. This is going to occur at 5 to 1,000 deliveries. You're going to get placenta previa. So signs and symptoms, third trimester pain and aching. It's going to be painless, but bright red bleeding, right? So it's going to be arterial blood. It's oxygenated. It's not going to be dark blood. Strongly associated with the number of previous C-sections and deliveries, so something to do with the scar tissue that's already developed in there. And most common cause of preterm bleeding, so placental previa. Abruptoplacenta, this is the partial or full detachment of a normally implanted placenta at more than 20 weeks gestation. So think of placenta previa, you're at third trimester, you're at the end of it for the most part. But with abruptoplacenta, it is more than 20 weeks. You're still kind of halfway through it. It's almost like a scab that's attached to the wall that hasn't fully formed yet. So like when you peel a scab off that's half healed in the skin, right? You feel that burn and it bleeds all over again. That's going to be abruptoplacenta. So signs and symptoms, third trimester pain, just like how it hurts with the scab, you're going to have that stabbing pain. It's going to be very painful, and you're going to have dark red bleeding, so localized uterine tenderness. Preeclampsia and eclampsia, this is one that you want to memorize. So preeclampsia is gestational hypertension at 20 weeks and at least one of the following. So they're going to have high blood pressure after 20 weeks, and they're going to have proteinuria. There's going to be protein and blood in the urine. They're going to have low platelet counts, impaired liver function, renal insufficiency, pulmonary edema, issues breathing, visual cerebral disturbances, severe HTN, which is going to be characterized by systolic over 160 and diastolic less than 110, IV oxygen, and calm transport. So with eclampsia, you're going to have preeclampsia, everything we just said, plus seizures. So seizures are eclampsia, and we want to give mag sulfate. Do I see that in here? Yep, here we go. 4 grams over 10 to 20 minutes. Drugs are important. Remember, mag sulfate for preeclampsia or eclamptic seizures. You're not going to give midazolam. So tonic-clonic activity, grand mal, it's going to be the entire body. It's not just going to be like a right or left limb that's shaking. Labor could begin suddenly and progress rapidly. Left lateral recumbent position, just like everything else, lay them on the left side. Oxygen and IV access for pushing drugs. So 4 grams over 10 to 20 minutes. Consider benzodiazepines, but we don't want to get the baby addicted to that, so stick to mag sulfate. Each seizure increases fetal mortality by 10%. This can occur up to 4 weeks postpartum, but that is rare. For postpartum hemorrhaging, 5 milliliters of blood loss after delivery occurs within the first 24 hours. It's going to account for 25% of obstetric death. Management, we want to give a fundal massage or fundus massage. This is going to release oxytocin. It's going to help with the uterine contractions, encourage the newborn breastfeeding, and administer oxytocin of 10 units to 1 liter. Infuse at 20 to 30 drops per minute. So whenever you give a fundus massage, it's not as low as you think it would be. It's actually pretty high up, almost like, I want to say below the xiphoid process, or somewhere close to it. Like, it's not really low like you think it would be. And you're not just like slightly pressing it, like you're treating it not like a punching bag, but like you're kneading pizza dough, right? And that you're doing this for the sake of stopping the bleeding. Another thing you can do is encourage the woman to breastfeed. Yeah, here we go. So encourage newborn breastfeeding. This also releases oxytocin as well. Amniotic fluid embolism. So you're going to have amniotic fluid that enters the maternal circulation during labor, delivery, and immediately after throughout lacerations of the endocervical veins, lower uterine segments, or uterine veins. It's going to occur in 6 to 15 per 100,000 pregnancies. Maternal mortality rate is high with this, and signs and symptoms that mimic that of a pulmonary embolism. Chapter 3 for more on that. Trauma during pregnancy, so you could have an aggressive resuscitation. Make sure there's ABCs first. After the first trimester, never transport a pregnant patient flat on their back. You will put that baby's weight on their vagus nerve and superior vena cava, and it's going to stop perfusion through the rest of the body to the heart. Supine hypotension syndrome, that's what this is called. So we're going to transport on the left side. That's our favorite side, the left side. Keep your right hand handy because most people are right-handed. So think of it like that. Your right hand's up in the air. If spinally immobilized, we're going to prop up on the right side of the backboard 6 to 12 inches to achieve a leftward lean. Let's stop there.